All right, now on to the Physician's Assistant Program, or the PA program. This takes about 5 years to complete. Upon completion of the PA program, a student is known as a physician's assistant. They do have to take boards. They are going to serve as a primary healthcare provider. They're going to be able to diagnose, examine, prescribe medication, and they can also serve as their patient's sole healthcare provider. Some general concerns with Shadow Health for PA programs. So PA students have very little clinical experience in the beginning. They get a ton of coursework as far as, anatomy and physiology and the sciences and stuff like that, but their clinical experience does not happen until much later in the program. So the concern is that these students would struggle with the complexity of these exams because they have no clinical background to draw from, much different from a nurse practitioner who has been an RN for a period of months to years. So they do have some of that clinical background. These physician's assistant students don't have the benefit of any of that. So oftentimes faculty worries that they will struggle through these because the exams are so complex. So some discussion points for that. Again, I would emphasize that interview guide for the health history and get students into the rhythm. I may leave that interview guide on even longer for these students since this will really be one of their first clinical experiences. Turning it off at some point is also a viable option. I would also emphasize that this is a learning tool and their students aren't going to be perfect at it, but it really will help to practice and gain confidence in their assessment skills and their interview skills so that when they do head into those clinical assignments, they will feel more comfortable and more prepared to work on human patients. As far as their courses go, they have that history and physical exam course, and I feel like our advanced health product is a great fit there, as well as they could use those concept labs in anatomy and physiology to really, again, allow themselves to become very familiar with what they are going to be working with. They have an assessment course, which is like a clinical portion of the history and physical exam. This is a really nice fit for us as well. We could actually use our Shadow Health assignments to prepare them for this clinical lab. So that's a tactic that some instructors take. And then intro into patient counseling and education. I think this is a kind of a nice fit because, again, they have no experience in patient counseling and education. And Tina Jones offers them so many opportunities to really educate on a lot of different ways. So that might be a nice secondary fit there as well. And in the same with clinical encounters. I have here that Gero might be nice here because the older population is often where a lot of schools will start. So having them work with our gerontology patients with their myriad of different, levels of interactions of medications and all kinds of concurrent disease processes might be a nice way to tie in some of the more complicated patients. Focused exam, Danny, for their pediatrics course, and then finally the advanced or applied pharmacology would be a nice fit for our advanced pharmacology course because these students are going to be doing those prescriptions and need to really understand how that type of thing works. So our advanced pharmacology program would be nice here as well.